My name is Katelyn Bruno. I'm a postdoctoral fellow at Mayo Clinic in Jacksonville, Florida, in the Department of Cardiovascular Diseases. I have recently presented at the International Academy of Cardiology Annual Scientific Sessions 2017 in Vancouver. My talk was on sex differences in vitamin D and inflammatory heart disease. I had the privilege of giving this presentation about my research on vitamin D and vitamin D receptor. Many people are unaware that vitamin D is actually a steroid hormone made from cholesterol in your skin and actually has effects on the immune system as well as its role in calcium regulation. We studied basic science animal models as well as translational research. And in our animal model of acute myocarditis, we found that the vitamin D receptor, when knocked out in our animal model, found that it's actually protective in female mice but harmful in males. This was seen when you knock out the vitamin D receptor in females. These mice had increased T cells, interferon gamma, IL-1 beta, inflammasome activation, and other immune activation pathways. Whereas in males, we saw decreases in your T regulatory cells, increases in your mast cells, as well as increases in your M2 macrophages. So this is what we found here, was that vitamin D receptor is actually protective in females with acute myocarditis, but could actually be damaging in males. We then looked at whether an actual deficient diet in vitamin D in the animal model would have the same effects as seen as in the vitamin D receptor knockout mice. We have currently looked at what can be seen in female mice given a vitamin D deficient diet and saw that female mice with the vitamin D deficient diet had significantly worse heart function, suggesting that in females, vitamin D seems to be protective. Next, we then assessed how this could then translate into clinical patient samples. When we looked at the vitamin D status in both male and female myocarditis patients, we saw that there were correlations with the percent ejection fraction, with lower ejection fractions leading to a higher risk of heart failure. When you had males and females grouped together in this correlation study, you had no significant correlation between vitamin D and ejection fraction. But when you separated out males and females, you saw that a higher vitamin D level in females led to a higher ejection fraction or better outcomes, less heart failure. Whereas in males, a higher vitamin D level actually correlated to a lower ejection fraction and a higher risk for heart failure. This mimicked our animal model, showing that vitamin D is actually protective in females but could be damaging in males during acute myocarditis. And this is very important to understand because vitamin D is given as a supplementation in a number of patients, and there haven't been good studies showing the actual mechanism of vitamin D in specific diseases. So these type of mechanistic studies are very important to continue and determine the actual effect.